It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome, my friends, to another Sam Lesante Show. We're continuing our healthcare information brought to you by Lehigh Valley Health Network. My friends, it just gets better and better. Today we have some great news for you, and we'll talk about that pretty soon. Joining me today is Terry Purcell. He is the president of Lehigh Valley Hospital, Hazleton, and president of the Northwest region, and Dr. Ammar Abbasi, no stranger to our area. Terry, welcome to the show.
Welcome, Sam. It's a pleasure to be here.
Boy, a lot of exciting things are happening.
There's a lot of great things going on. Right now, the healthcare industry, there's a lot of pressures going on in the healthcare industry. We're seeing a lot of staffing shortages. We're seeing supply chain issues. But I'm pleased to say that the LVH Hospital in Hazleton continues to do a great job in serving our community.
Let me tell you a little story, okay? This is probably close to 6,000 shows I've done throughout the years. I've interviewed a lot of people. I've interviewed a lot of people who are sincere, a lot of people who are phonies. I met them all, etc. We start getting involved with healthcare in Lehigh Valley, and I have to tell you, and not to patronize anybody, but kudos to the network, Lehigh Valley Health Network, because they are involved with the community. They are compassionate. Your organization is concerned about the patients. There are a lot of, and I'm not putting anyone, there's a lot of health facilities, cliches and the whole bit, and actors, etc. But you guys are real. And the response I get, especially now that we're increasing in the community partners in Schuylkill, from people when my wife and I are out, etc., and thank you for having them. Thank Lehigh Valley Hospital because you're concerned. And I have to applaud you for that and the entire organization. And I go for my physicals every year. In fact, I'm going to see Dr. Benyo again today. Better have good news for me. But I was up into healthcare and got blood work and some x-ray. And everyone was great. They were very gracious. And when they call for, to evaluate, and please, when you get those calls, answer them because it's important for you guys. And it's sincere, and I have to tell you that. Just have to applaud you for that.
I do appreciate that. One of our mottos is we're not just a health system. We want to be your partner. So it's a community partner. It's a health partner. So we're involved with Salvation Army. We were involved with the Christmas dinner. So it's important for us to be involved in the community because we want to be everybody's partner.
You don't just talk about it. You do it. Tammy always is concerned about, are we getting this message across or that message across? And I think a matter of information is always important, and knowing them. When you were on the show a couple times, some people said, I went to see Dr. Abbasi. It was like knowing you already because they saw you on the show, and it's local people. Terry, tell me about the expansion, and it's amazing how you're recruiting and the new doctors we're having, and we'll break it down when we talk to Ammar.
So most health systems have a hard time recruiting to rural communities, and in Hazleton we've been very successful. In the calendar year of 2022, we recruited 26 new providers to Hazleton, which is absolutely an incredible number. It ranges from orthopedic surgery, cardiology, primary care. So we've done a great job from a recruitment standpoint, and our goal is to increase access to the local community so they don't have to wait to see a physician or they don't have to travel to see a physician. So we've recruited 3 part-time cardiologists since I've been here. The most recent one is Dr. Natarajan. He grew up in the area, he graduated from Freeland MMI, and he's back taking care of the community that he grew up in, so we're very proud of that. We have a strong need for OBGYNs in our community. We've been able to recruit Dr. Usman. She's from Berwick, so when Berwick Hospital closed, she joined us to take care of our local residents. So we're seeing a lot of patients from the Berwick area now coming to Hazleton for their care. Family medicine, internal medicine is very important to us. There's a need for primary care providers throughout the United States. We've been able to recruit 2 new physicians that joined us already. They're in our Mountaintop, and they're also in our Vine Street facility. We have one of our physicians is Spanish speaking, and he's in Vine Street taking care of those people that don't speak English. So it's very important that we're doing that. We recruited a nurse practitioner and a PA for primary care. One joined Jody Lanko within the last year.
Good person.
Great person. And we have another doctor that's joining us in 2 weeks. Her name is Dr. Nicole Balchun. She's joining us from another network, and she'll be here taking care of our local residents. So we've had a tremendous success this year in recruiting providers, and that's going to help our system grow and continue to grow into the future.
What do you attribute that to? Because I know, dealing with different health organizations throughout the state, some are having difficulty recruiting and, et cetera. What is it that you're able to obtain these great people?
There's two things that I think are key to our success. First of all, our local physicians are outstanding. We have a great mix of physicians that grew up in the community and physicians that came out from outside our community that have fallen in love with our community. People like Dr. Abbasi, Dr. Mohidan. So we have a great medical staff. We have a lot of people like Dr. Valent that grew up here, Dr. Lobit. So we're fortunate to have an outstanding medical staff. Secondly, the community sells itself. Hazleton's a beautiful area. When we tour a physician and they see the community, they see Hazleton itself, they see the Eagle Rock and the developments around us. It's a great place to live, it's a great place to raise a family, and it's a great place to practice their profession.
When you say that, people who live here, sometimes, you're in the forest, you can't see the trees, that kind of stuff, and then someone from outside comes in, and they see different things, like you're mentioning, you have Sand Springs, you have Sugarloaf Golf Course, you have all these wonderful places here that are the amenities. School system, doing very well. So, and especially when they bring their wives in, or wives bring their husbands in, it's vice versa. They're looking for all these amenities, etc., and it's nice to hear that.
Absolutely.
Congratulations on that, because that here is amazing. What do you... when you're looking for someone, okay, you just don't take anybody, okay? What are some of the criteria so our viewers know that when they're going to a Dr. Abbasi, or they're going to a Dr. Favela or a Dr. Benyo, of course Phil's been around here a zillion years, what do you think your concerns of getting these people? What are your qualifications?
So one thing at Lehigh Valley, we have very high standards. We won't just hire anybody. We want someone, A, preferably that they're board certified. B, we want to make sure that they have some tie to the community or have an interest in staying in our community. We don't want to hire people that just leave after. We don't want people coming because it's a job. We want people coming here because they want to retire here. We're looking for people that are committed to quality care. We're looking for people to be part of the community. We don't want people just to come in and work. We want them to join the different groups that we have in the community so they could be seen by our neighbors and be out there in the community.
They know that up front then?
They know that up front.
That's fabulous. Now, we have some interesting things happening. Doctor, nice to see you again.
Pleasure, as always.
Okay. How's everything going?
Wonderful.
Family, everybody's doing a good job?
Yep, absolutely, yes.
So we got a new title for you now, right?
Yeah.
Isn't that, are you excited about it?
I'm always excited. I'm grateful and appreciative of it.
So the title you have is what?
So I'm the medical director of Hazleton and Schuylkill for Lehigh Valley Physicians Group.
Okay, tell me what that comprises.
So I think the role is really, most importantly, I think for our audience and our viewers here, really being the voice of the community for Hazleton and Schuylkill, and translating our needs from this area down to our leadership at the network is one of the major goals of my title. Another important role I play is retention of our providers by building relationships with our providers. I'm also responsible for ensuring quality in our outpatient offices. We're working heavily on resourcing, assimilating the resources between Hazleton and Schuylkill together so that we can be a more powerful unit, and then working on patient access and overall wellness of our providers so that they can stay and for the long term here. So those are the kind of the major points that we look for in my role.
Folks, I'm talking to Dr. Ammar Abbasi and Terry Purcell talking about healthcare in this area. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7 SSPTV.com and our YouTube channel get all of our local programs, and we're very happy to have the Standard Speaker, as you know, as our media partner, and also the Pottsville Republican Herald as our media partner. If you pick up their papers, there's a lot of information there. Talking about information, you know, we're known as your healthcare station. We're very proud of that, and we're very happy to have Lehigh Valley Health Network as one of our major sponsors participating in bringing these shows. My guest today is Terry Purcell, the big man, president of Lehigh Valley Hospital Hazleton and president of the Northwest Region, and Dr. Ammar Abbasi, no stranger to our area. Doctor, so tell us what you've been doing, and, you know, is no stranger, as they said, to the area.
Yeah, I've been here for about 10 years now.
Has it been 10 years?
It's been 10 years. I just celebrated 10 years in July.
So when you first came here, you were on my show, right?
Yes, July of 2012.
Is that right? Geez, I was 29 years old at that time.
That's right.
Yeah. So you're continue on what you've been doing here then.
Yeah, so I have a practice. I practice physiatry, or physical medicine and rehabilitation. So taking care of neck pain, back pain, spine pain, joint pain, and doing some nerve testing in the office.
Yeah, so here again, no stranger.
No stranger.
In what you've been doing, there's a lot of great news on the orthopedic area. Let's talk about what's happening with orthopedics.
Yeah, orthopedics has been really rolling. I think one thing that we talked about, I think back in 2012, about 10 years ago, is we really wanted to bring a group of providers together to serve the area and start an orthopedic institute. And I'm really happy and proud to say that in the beginning of last calendar year, we Coordinated Health and Lehigh Valley have kind of merged together finally to come up with Lehigh Valley Orthopedic Institutes. So at this point, you know, we're no longer one or the other. We're actually Lehigh Valley Orthopedic Institute. So all our providers are kind of under one umbrella. So that Station Circle, 26 Station Circle location at Humboldt, now rebranded as Lehigh Valley Orthopedic Institute. So we have all our orthopedic, podiatry, sports medicine, chiropractic, physiatry providers all under one roof.
Will you still be practicing?
Yes, absolutely. Couldn't give that up. Really enjoy that type of work, and I think it's important as a medical director to really have a good grasp of what's happening at the front line too.
Let's talk about robotics. It always fascinates me. You tell me about the robotics in the orthopedic and what you have at the hospital.
Yeah, so really great to have Dr. Falvello actually return back to the community and join us at Lehigh Valley Orthopedic Institutes, and he actually uses robotics, the Vales robot, really to do total knee replacements, and it really actually makes the procedure much more precise. So he's really proud about that type of work, and we're doing that work right here at Lehigh Valley Hospital in Hazleton.
Have you seen any procedures done with the robotics?
Yes, I have, and so the robot's actually an extension of the surgeon, so it's not as if they're not involved at all. Yeah. So we have both in there, so it enhances.
What's the difference?
I think it's precision, the level of precision and accuracy. So it's usually more chance of a better fit, and that's really the story of it. We look at robotics even in general surgery. All our general surgeons, Dr. Mahoney, Dr. Corrado, Dr. Itokapan, who's a new provider, a new general surgeon that has joined us, and Dr. Nachumson, all certified in robotic surgery also. But it really enhances the skill of the surgeon, makes things a little bit more precise, and all do that type of robotic surgery here at Lehigh Valley Hospital.
If I could give an example, so a friend of mine had anterior hip replacement from Dr. Favela. In 4 weeks, he was out golfing and bowling. That's how quick the recovery time was. So
That's
the
fantastic.
recovery time
Wow.
is actually a lot better. So it's better for the patients and their recovery. So
Never
a
thought
lot
of
of great things going on at Hazel.
So that's an anterior hip procedure is another type of procedure that Dr. Falvello does, as opposed to the typical hip procedure that's done. So that's which has, like you said, a faster recovery time. again, that's a skill set that Dr. Favela brings to this area.
And he's explained that procedure on our show. Be interesting for you to go to YouTube and look at that, because here again, when people are looking to, they need a hip surgery or knee surgery, and who wants surgery? Okay, they want to make sure that, and then they hesitate. We'll wait. I'll take a couple of pills. You know, you hear that all the time, and that's not the way to go. The way to go is get it done. Okay, wouldn't that be your advice?
I think you look at it, you know, surgery in general, you look at it from a quality of life standpoint and a pain standpoint. You know, are you able to do the things that you like to do? Are you able to survive the way you want to survive and get around? And if it gets to the point where that's not happening, I think it's time to consider surgery. I mean, every year that you wait and you're not able to attend the graduation or not able to go on a trip, these are things that you can do if you've had a replacement of a hip or a knee. So really a lot of things to consider in terms of quality of life. You really want to enjoy those years that you've worked so hard to get to.
So very important. In the surgery department, so what's happening there? There's a lot of great things happening there.
Yeah.
Terry keeps bringing them in. More doctors are coming in. Terry, you got to slow down a little bit.
Yeah, Dr. Nachemson is a board-certified colorectal surgeon. He's actually been with us for a couple of years now. Dr. Mahoney, board-certified general surgeon, has really done a great job in reviving our bariatrics program, which has been fantastic. Dr. Corrado, no stranger to this area, really Hazleton native, does a board certified in general surgery, does robotics work, does vascular surgery and breast surgery, all done at Hazleton. And then Dr. Itokapan, really a new surgeon, a fantastic guy, board certified in general surgery and robotics, new to our group, just came in the fall of this year. Fall of 2022, I'm sorry.
And our ORs are so busy, we're getting ready to expand and open a 4th OR, because that's how many surgical procedures we're doing at the hospital. So just a lot of great things going on at Hazleton.
Terry, how do you keep track of everything?
It's organized chaos, but no, it's just, I have a great team. So when you look, it's not just one person, it's our administrative team, it's our department leaderships, it's our physician staff. We all work together in Hazleton.
Yeah.
And we have calls regularly, we text regularly 24/7, and we're a team. And together as a team, you can get a lot more done than one individual person.
Boy, isn't that the truth? And you guys do it so well. As a medical director, I alluded to this before winter break, sometimes people have concerns, all right? And you know, they are upset about different things, and we're all human. I mean, there's the things. How do you address these concerns? All right. As a medical director.
I'm gonna get back to your question. I just want to mention one more fellow. We also had Dr. Hernandez, a board certified hand and upper extremity specialist that's working in this area now too. So really don't want to understate how much of a renaissance we've had in this area.
It's amazing.
Yeah. So I think, you know, the patient surveys are super important. I think it's really important that we, as patients and in the community, we always fill them out, whether we're having a good experience or not so great experience, and really put our comments in there. What happens once that information is put in there is that we, if there's a comment that's, you know, something that as a major concern, it's flagged. It goes to our practice managers. Our practice managers are then put on task to address that issue. So you will be perhaps reached out to address that concern directly. So please, you know, don't ever feel that comments are not being put to good use. And all of that information is also being fully transparent on the websites. It's given back to the provider so that we can change care. And it's really looked at all the way up the chain to our managers, our department chairs, and all the way up. And it's even, you know, tied into our quality metrics and sometimes even into our compensation. So very heavily, very important that we do a great job for our community and our patients, and that everybody's satisfied.
And the first thing I do when I get to the work in the hospital every morning, I look at those the feedback comments. I'll address them myself. I'll call patients myself, and we also thank patients. You know, 99 out of 100 comments are very positive, and they're thankful we're here. So we thank them for the positive feedback also.
You know, there's another thing too is having compassion. You know, I know when you're sick and you're going to a doctor and you're waiting, or you know, you have a receptionist, and I got to tell you, I went for my blood work and routine up here just last week, my wife and I, and everyone was fantastic. And you know, they were very busy that day. They were staffed up, and you know, and there's a lot of stress sometimes, and to be able to manage the stress, and a person is, they want that undivided attention, which is rightly so, Terry and Ammar, but the point is how they were able to cope with that. And sometimes you're a human being, and sometimes it may not be, something may be said that you don't really mean to say. It's called being human, and I think we should have a little compassion for those areas, But however, if it's downright not right, then we should
bring it up.
Yeah, bring it up.
Sure.
Terry, and when you're looking at, we talked about this once before. How do you know what areas, because you mentioned all these different areas that you brought doctors in, okay? How do you know, and maybe you could answer this as well as Ammar, how do you know who to bring in, what areas to fill in? Is it orthopedic, surgery, family, the whole bit? How do you know that?
So we do a market analysis several times a year. We look at what population we have in each zip code, what providers are there, and there's different population ratios per provider that we look at. And so we look at each community, what we need in each community, and what specialty we need.
And then that's how you were able to determine. Okay, I'm talking to Dr. Ammar Abbasi, who is the new medical director for LVPG for Hazleton and Schuylkill, and Terry Purcell, who is the man. We'll be back right after this. Welcome back to the Sam Lesante Show, folks, your healthcare station. We're here with Terry Purcell, who is the president of Lehigh Valley Hospital, Hazleton, also president of the Northwest region, along with Dr. Ammar Abbasi, who is the new medical director for LVPG in Hazleton and Schuylkill. So the Cancer Center.
We're very excited about our Cancer Center.
It's doing well.
It's doing well. It's a $22 million investment that Lehigh Valley's made in the community. There's 67 counties in Pennsylvania. Luzerne County has the 5th highest death rate from cancer in the state of Pennsylvania. So it's a much needed service. Once we made the announcement, wherever I'm at in the community, you would not believe how many people come up to me and say, "Thank God you're opening the Cancer Center, because I used to have to drive to Allentown for my cancer treatment. Now I could just go to Hazleton." So this is going to be a regional cancer center. This will serve the Hazleton area residents, the Schuylkill County residents, and our Carbon County residents also. So our plan is to open August 1st of 2023. So we're getting close this year, and the construction's moving very quickly.
Wow.
And it's looking great, and we can't wait to open it. We have a new physician that's joining us. His name's Dr. Decker. He's a fellow with us right now. He's from the Wilkes-Barre-Scranton area, so he's going to cover the Hazleton and the Dixon City location. So we're going to have a newly trained physician with us to join Dr. Hutchner and Dr. Evans, taking care of our cancer patients.
Two great people, too. It's fascinating how advanced we become in care of cancer. I mean, you don't want to get it but however, thank God you have a facility like Lehigh Valley Health Network that if you should have it, you're under the best care you can. And boy, Evans and Dr. Austin have saved many, many lives, through the advances. And I think it's a great thing that I can imagine when this opens, what the new technologies that you're going to have there. Am I correct?
That's correct. And we're also affiliated with the Memorial Sloan Kettering Cancer Alliance. So there's only a few hospitals in the United States that have that affiliation. So we're going to be bringing cutting-edge cancer care to the Hazleton residents.
He said something during the show, my friends. He said that we're always in communication and talking. Sometimes you go to a doctor and you say, well, I'd like to get a second opinion. Well, sometimes you're getting second, third, and fourth, and fifth opinions. I say this all the time on the show because they all talk, and if they're concerned, they're talking to other doctors. So it's not just one doctor. So really you are getting many other opinions. Am I correct in saying that?
Yeah, absolutely. So a lot of what we do is discuss things through the medical record. We have multiple ways of communicating through Tiger Text, which is a technology tool. A lot of us even share cell phone numbers. So collaboration between providers is very, very important, and that's what the institutes are built based on. So the Vascular Institute, the Orthopedic Institute, these are all based on providers kind of talking to each other about cases. So you're getting more than one brain working on your
yes.
case.
Yes, I have to stress that, enough. Once, as I started the show, Terry, I want to tell you that I kudos to LVH, Lehigh Valley Health Network, Brian Nestor and the entire group. This is an health organization that really truly says what they believe and has the compassion, and I have to congratulate for that. Okay, got to tell you, he just got engaged.
That's
huh?
right.
We're looking forward to many big things. Okay, when you have the big wedding, invite us. Okay?
Of course.
Okay, I'll bring Sammy.
Bring the cameras.
Bring the camera.
Yeah,
The
yeah.
best of luck to you in the
Thank
new
you.
position.
I appreciate you.
Okay, you're a good person, Terry. It's always nice seeing you.
Thank you very much.
We'll see you next time.